Well, good day, everyone, and welcome to the third and final installment of the 9th Annual Analytics Summit Virtual Edition, brought to you by the University of Cincinnati's Center for Business Analytics, a part of the Lindner College of Business. I'm Glenn Wagren. I'm the Executive Director of the Center, and together with Dr. Mike Fry, the Center's Academic Director, and the Center staff, we're all delighted to be able to bring to you a part of the live event, which has really become a must-attend event here in Cincinnati for business leaders, analytic practitioners, students, and faculty to meet, hear, see, and learn about the successes and the challenges to drive value in the practical application of analytics across industries and disciplines. Now, as I mentioned, we're honored to have several Tableau Zen Masters join us today to address our theme, Visualizing Unexpected Events. With us today are Steve Wexler from Data Revelations, Chloe Seng from Viz for Social Good, and Chantilly Jaggernauth from Lovelytics as our speakers. Now, following a similar format as in our previous webinars, we'll first meet each of these speakers, say hi to them, I'll let them say hi to you, and then we'll turn the mic over to them for their presentation, and then we're going to follow that with a Q&A from the audience. Now we're going to wrap up the event with a panel discussion with our three speakers, and we'll also have Jeff Schaefer from Unifund join us. So if this all sounds good to you, then let's get things started here. Okay, well, welcome back, everyone. Next up is Chantilly Jaggernauth. And see, Chantilly, she's coming up.
Hey, how are you?
Very well, how are you?
I'm doing pretty good, glad to be here.
Good, very good. All right, so Chantilly is a 2-year Tableau Zen Master, and she specializes in data viz, data analytics, design, and training. Currently, she serves as the Vice President of Data Visualization and Training at Lovelytics, based in Arlington, Virginia. And Chantilly is also the founder and CEO of the nonprofit organization Millennials and Data, #MAD. Well, hi, Chantilly.
Hey there.
Hi there. So we just met just very recently here, and so why don't you tell us a little bit about your background and about #MAD?
Yeah. So I actually started, on this data visualization and data analytics journey about 10 years ago. I picked it up as a student. It wasn't something that my school taught me, but something that I taught myself. So I used some of the fundamentals that I learned in school. And then I used some intern experience as well as some on-the-job experience with Johnson & Johnson and kind of went down this path. And I started Millennials in Data about 2-3 years ago when I noticed that there was a huge gap in terms of data literacy skills among millennials, and I wanted to start to bridge that gap. I also noticed that there was a diversity gap, among diverse data analysts, that I was working with, and I wanted to bridge that gap as well. So I launched Millennials at Data at Howard University, which is a historically Black college and university based out of DC. And so far, we've had 3 cohorts. This last cohort, we actually expanded beyond Howard and let in additional schools as well as professionals. And throughout the program, we teach students and professionals how to read, write, and understand data and data visualizations.
Wow, awesome. And so 3 cohorts. So how many folks total are we talking about?
We had 10, 15, and then 10 again. So about 30, close to 30, over 30.
Yeah. All right. Well, good start there. So I'm not going to try to steal any thunder for your presentation. So I'm going to, without any further ado, turn the podium on over to you, or the microphone over to you, and have at it. And I just want to remind the audience again too, please fire those questions into the Q&A, and when Chantilly's finished here, we'll Mike Fry and I will come back on here, and we'll pepper her with lots of questions. So Chantilly, it is all yours.
Awesome. And we're good in seeing my screen, right?
Yes.
Awesome. Sounds good. Thank you all for having me today. Today, I want to talk about workforce planning analytics and how we can use data visualizations to identify employees at risk and how we can use data visualizations to prepare for a recovery within organizations. Prior to joining Lovelytics, I was at Comcast for about 3.5 years, and the majority of my time at Comcast was spent within HR. So I understand a lot about how to use employee data effectively and how to create some impactful visualizations that can drive business strategies. And I want to touch on a few of those today, specifically around COVID-19 and how organizations can adapt, during this pandemic. So let's dive right into it. And I have 2 cases that I'd like to share with you all today. So the first use case that I'd like to talk about is identifying employees who are at risk. So the goal of our first use case, the first use case, is going to be to combine employee data with COVID-19 case data to spot and monitor employee exposure. So it's important to understand here that, case data really doesn't provide too much information, but it's a really good starting point in understanding where the epicenters of the virus are at, right? So it's not going to give you the entire picture, especially, when testing is delayed and things like that, but it does provide a good starting point to allow you to dive a little bit deeper. The second point that we want to touch on today is how can we securely visualize employee survey data to quickly understand morale and engagement, and then easily combine that with attendance data to provide support needed. And last but not least, how can we administer more agile support models like financial assistance, backup family care, and flexible shifts to employees impacted by the virus? Now, to do all of that and to dive into it, there are some things that we need to understand about the data, right? So we need to understand the COVID-19 data and reporting on that case data, and then we also need to understand our employees as well. So I'm going to talk a little bit about the data first, and then how we can bring all of that together and create some impactful visualizations. So the data. In terms of the COVID-19 data, the data source that I used to gather this information was actually provided by Tableau. On their website, they have what they call a Tableau COVID-19 Data Hub, where you're able to access various COVID-19 data sets. They also provide visualizations that were created by organizations and community members that allow you to stay informed on various aspects of the virus, whether it's tracking hospital utilization, whether it's tracking the number of cases. There are a wide-ranging set of visualizations that you can, dive into and start to understand the epicenters of the virus. So as I mentioned, the data set that I'm actually using is right here on the COVID-19 Data Hub, right? So you can easily scroll down, and if you would like to access this data as well, you can scroll down to access the data and directly download it either from data.world, AWS Exchange, or MuleSoft. And I'm using the CSV download that is located directly on data.world. So here is that data. From there, the next set of data that we needed was employee data. Now, this is a sample data set because obviously employee data is very sensitive information. Now, in order to understand employees that were at risk, we had to collect, some information that helped us understand exactly when the employee was born, so their birth date, as well as a self-identified medical condition field. So according to the CDC's guidelines, an individual who is at risk is someone who is over the age of 60, as well as someone who may have had or who currently has a previous medical condition. Now, typically when you start an organization, you provide them with certain information like your gender and your birth date and where you live, and those are other things that we need in order to start to understand which employees are at risk. But we didn't want to just specifically say that anyone who was over the age of 60 was at risk, because then that could tend to lead to to age bias, right? And you really do not want to communicate that when you are creating visualizations and putting them out there or showcasing it to your organization, right? So we wanted to stick to some of the CDC's guidelines in terms of identifying individuals who are at risk. And in this scenario, we sent out a survey to all of the employees that they could either opt in or opt out, which a lot of organizations do. And we asked them to identify whether or not they had a previous medical condition or a current medical condition. And some of those could be, you're diabetic, you have asthma, just anything like that could just elevate your risk of contracting the virus. So we took that data, that COVID-19 data, and then we also took the employee data and we brought them together based off of the state locations. And here is the data, the first visualization that the team and I was able to create. So in this visualization within Tableau, as I mentioned, we joined those two data sets based off of the location. On the left-hand side, we provide a breakdown exactly when this data was last refreshed. So Tableau does a really good job of uploading the data every day and providing you with some of the latest stats that are out there. And they also do a really good job of providing you with the data source and where they retrieve that information from. Now, because in this scenario, our offices are only based in the United States, we are solely focused on the COVID count case within the US. And as you can see, as of the 27th, that was at about 2.5 million. So that's right here. Next, down below that, we have a view that is broken out first by the number of employees, but we can change this to either confirmed cases or a number of employees at risk. So before I change it, I'll explain exactly what's going on here. So in this instance, all of our office locations are based on the East Coast. And what we've done here is we have just counted the number of employees who are located at each of those sites. So the location that has the most number of sites for us is our Florida location. So within Florida, we have several office buildings. Within New York, we have several office buildings, but the majority of our employees are based out of Florida. Now here, I can go ahead and adjust this to confirmed cases. And as you can see here, New York has been one of the epicenters of the virus. So New York is number one in the U.S. in terms of confirmed cases, and then in terms of where our employees are located, it's number two, right? So I'm not saying we can draw any sort of direct correlations here, but it can just provide you with some insight into, okay, most of our employees are either located in Florida or New York, a lot of them are, and then you have New York as number one in terms of highest population that has the virus, and then Florida as number three. So that should just start to ring some bells for you all. And then in terms of employees at risk, we have Florida at the highest, and then New York at the second highest as well. So in terms of employees at risk, I'll say once again, when we brought this data into Tableau, we created a calculated field that said if, based off of the birth year, if the employee was over the age of 60, or if they had identified that they had a pre-existing medical condition, then we consider that employee as an at-risk employee. Now, when we turn to the entire dashboard itself, we once again have that entire, confirmed COVID case count. We have the total number of employees across the United States, and then we have the number of employees who are at risk. And you can hover over this and see exactly, that information as well. And then we have the percentage, right? So of our entire organization, 62% of our employees are at risk based off of age and based off of pre-existing medical conditions. Now, to the left, or the top left-hand side, we've now broken out our total employee population as well as our employees who are at risk by the locations that they sit in. And this might be, important as, states start to open up and we're trying to identify, where those employees are located at, who are at risk, and we may want to delay those buildings in particular from opening up. So as you can see here, Florida building number 3, Florida building number 1, 2, 5, and 4, they have the highest number of employees who are at risk. And you can scroll down and see exactly for each location, which buildings have the total number of employees. So the white bar is the total number of employees, and then the blue bars represent the number of employees who are at risk within that particular building. Now, to the right of that, we have a breakout based off of the age distribution of our employees who are at risk. So here we're diving into our employee data just a little bit to understand exactly which age groups outside of the ones who are 60 or older are also at risk. And as you can see here, those who are 40 to 45 are also at risk within our organization. What you don't see here is that the 60 to 65, 65 to 70, and 70 to 75 bars, you don't see that those are just the only ones that are shaded blue. because as I mentioned before, we want to make sure that we aren't incorporating any type of age bias into this visualization. So that's why we are breaking this out by the age groups and making sure that we identify within each particular age group, how many of those employers are also at risk. In the bottom left-hand corner, we have the distribution, and the gray represents the distribution of cases, so the number of confirmed cases by state, and then the blue circles represent the number of employees who reside in that state. And then to the right of that, we have the breakout now by city. So here you see Washington, D.C. Is at the top based off of cities. That's probably because, Washington, D.C. is just, the one district in itself. But then you have New York City and then the various cities within New York State as well that will be broken out in this employees and at-risk groups by cities. So now if we wanted to dive a little bit deeper into like our Florida location or even our Virginia location, because I work out of a Virginia office. So if I wanted to understand, who is at risk within our Virginia office, right, and how many employees are at risk, I can simply click on Virginia on the left-hand side, and I get the case count for Virginia. I get the number of employees who sit in the Virginia offices. I also get the number of employees who are at risk within Virginia, and then I still get that same breakout based off of the previous, the overall breakout that I showed you all. It's now broken out just for Virginia. So now we can see exactly the buildings that we may want to delay opening. We can see the age distribution. We've zoomed into the map, and then we can now also see based off of cities exactly where our employees are located at in terms of cities and where they are, where are they, those who are at risk. So yeah, this is that visualization, and as I mentioned before, it simply just provides a starting point, right? So of course, with a visualization like this, you would want to dive a little bit more into your numbers behind the scenes. Typically, if I were an organization and I downloaded this workbook, I would of course create this visualization, but then I would also dive into the data a little bit more behind the scenes. But because this is employee information and that data is sensitive, we're just showing it at an aggregated level right now. If we wanted to, dive a little bit deeper into identifying exactly who these employees are, these visualizations provide a really good framework and understanding to better dive into the insight and identify those employees and maybe help some of those employees and just reach out and communicate with them to make sure and understand if everything is going okay. So this is that first use case. So now the second use case that I would like to dive into goes a little bit into detail around state policies and the states that are opening up. So within the past few weeks, a lot of states have gone through several phases of opening up their states and their businesses, and a lot of that has been phased. I know here in Maryland we just had phase 2, or maybe it was phase 3, but you see these states starting to open up, and as they open up, there are policies associated with what's okay or what's mandatory and what's recommended for businesses or gatherings as they're opening up. And as states and organizations start to go or transition into that recovery period, some of them are actually going back, but as some of them start to transition into that recovery period, a lot of organizations are going to want to understand what are some of the state policies around being able to open up my organization and bring my employees back to work in a safe environment. So I want to dive a little bit into this use case and how we can visualize that data as well and dive into that data to start to understand state policies as businesses and states start to reopen. So the goal here is that we want to, once again, combine employee data with the COVID-19 case data and the state policy data to determine mandatory reopening policies per state. We also want to understand the number of employees who are currently teleworking per location. So I know right now at our organization, all of our employees are currently teleworking, right? But we also want to understand when we open up or when Virginia starts to open up, what is the policy around how many employees can be at the building at one time? So we want to understand who's working from home and who can we safely transition back into the office, to make sure that we are also sticking with state policy guidelines. So let's go into the data a little bit. So the data for the COVID-19 data, once again, was accessed or downloaded directly from the Tableau COVID-19 Data Hub. right? So I already showed you all that information. You can go to Tableau's website, and at the top underneath the resources tab, you can access this data and these visualizations for yourself. And then in terms of the policy data, this is also another data set that is available on their data hub. So on data.world, what Tableau has done is it's collected data from the University of Washington as well as Oxford, and they've cleaned that data file and provided you with state-level information about social distancing for each of those states. So any policies that any of the states have released, they've provided that information in some really clean files that are available for download. So you can filter to a particular state. You can start to understand exactly which policies are mandatory, which ones are recommended, and just get an overall better understanding of how can your organization safely reopen within a particular state. And then once again, we have employee data. Now here we don't have the at-risk employee information in this, but that's something that can be added to this data set. But the main things that we're focusing on with this employee data set is one, the teleworking field, which is flagged in the middle of the data set, as well as the locations that the employees are sitting in. So here's another sample data set that we're going to take, and we're going to join it with that COVID-19 data set to start to understand exactly where our employees are located at, how many of them are teleworking, and then as we try to transition those employees who are teleworking back to the main office, what are the state policies around that? So let's dive into that one. Alrighty, so here is the visualization that we've created to try to answer some of those key questions. On the left-hand side, the question that we're trying to answer is, where are our employees located? The size of the circles represents the number of employees who are located within a particular city. So here you can see Washington, D.C. is the largest because we have the largest number of employees who are located in terms of cities. But as we saw in the previous data set, Washington, D.C. is a district, so it's the only city associated with this geographical data point. So that's why it's really the larger circle on the map here. If you go down to Florida, you can see we have a large population of employees who work out of Miami. We have another large population that work out of Jacksonville, and then Atlanta. And if you were looking to try to understand this information at a state level instead of broken out at a city level, the bar chart down below provides you with the detailed information specifically around the states. So here we have Florida, as you could tell, has the highest number of employees, has the highest population of employees. Then we are followed by New York, and then Virginia once again. Now the right-hand side of the visualization automatically filters to whatever the last state was that was selected. So here I've gone ahead and I've selected Virginia. I can select Pennsylvania as well, but I'm going to stick with, let's look at Florida or North Carolina. There we go. I'll stick with North Carolina. On the right-hand side, we now see the number of employees who work specifically out of North Carolina. We have the number of employees who are teleworking in North Carolina, and then we have the case count overall, just for informational purposes on cases based out of North Carolina. So here we can see that about half of our employee population are currently teleworking, right? And we can then break that down by each of our office locations. So we have our North Carolina building number 3 has the highest number of employees total, with 52% of them being remote. So how many of our North Carolina employees can we transition back into the building, right? Out of those 52, how many can we start to transition back into the building, knowing that we may not be able to fit everyone due to some state policies? So that's some of the questions that you can start to answer with a visualization like this. Now, down below, we have broken out the various policies that are associated with North Carolina and what's been released lately. So we've grouped up those policies to business policy information, business other, gathering restrictions, mask in public, restaurant restrictions, school closures, stay-at-home orders, things like that. And as you hover over each of these dots, you can now read the information associated with that particular policy. So if we wanted to look at gathering restrictions and what was recently released, which is the green dot, we can see that on 5/22, they extended gathering restrictions, and it gives you the number of people who can be within the same space. So 10 people indoors, 25 people outdoor, and you can now click on any of these policies and actually view the PDF for it once it loads up right here. I don't know why that one didn't want to load. Let's try another one. Well, it's not previewing here, but I just went ahead and downloaded it. And here is the policy information right here. So everything that was released in regards to that particular policy point that we were just hovering on. And a visualization like this, as I mentioned before, can be used to help organizations understand exactly where their employees located at geographically within a particular location, how many are teleworking. You can start to get into information like, of those employees who are teleworking, who's okay with coming back to work, how many employees can we safely transition back to work, and you can use all of that in conjunction with the state policy information and start to understand exactly how many employees you can then bring back to the office. So with that, that was all that I had for you all today. Thank you so much for having me. If you'd like to get in contact with me, here is my information. And if you would like to download those visualizations and maybe start to use them within your own organizations, they are also available for download directly on Tableau Public. And here is our Lovelytics Tableau Public site. So you can scroll and you can download it for free.
Well, that's great. Well, thanks so much, Chantilly. Great talk. I know there are a bunch of questions did come in as you were presenting, and I'll turn it over to Mike here in a minute, kind of summarize those on up for you. But I'd like to go back to the employees at risk on your first use case, and I might have missed a little bit as you were describing. How exactly did you get to identify an employee at risk in that situation? So what are the factors that you were considering, and then how did you get to the actual indication of yes, they're at risk versus no, they're not?
Awesome. So very early on, I would say around March, maybe even February, the CDC released guidelines and just information around who would be at risk. And within the CDC's guidelines, they stated that anyone who was over the age of 60 would be considered at risk because of their age. And then they also indicated that anyone who had a pre-existing medical condition is someone who would also be at risk, especially if you had like asthma. And we know that this virus, plays with, doesn't do well with your lungs. So if you have asthma, then you could be at a higher risk. So in this scenario, we already had the employee birth date, which is something that whenever you go into an organization, you supply them with that information. You also supply them with your gender information. But what organizations have been doing during this time is they've been sending out surveys to their employees to allow them to opt in on whether or not they have a pre-existing medical condition. So if Lovelytics sent me a survey, I would opt in and I would say no, that I do not have a pre-existing medical condition. So we took that information and we said if anyone was over the age of 60 or if they identified that they had a pre-existing medical condition, then we termed that employee as an employee at risk.
I see. Okay. I know there's a follow-on question specifically on that. I'm going to turn it over to Mike about, I think you might have seen it on the work environment itself and a consideration on that. So, but I'll turn it over to Mike to cover that.
Sure. Thanks, Chantilly. Or thanks, Glenn. Chantilly, so there are a lot of questions. One, maybe just a clarification, because we've got some specific questions about some of the things you showed. But the data that you used here for the employee data was fictitious. Is that correct?
Oh, absolutely.
Yeah. Okay. Yeah. I think some people may have made.
Yeah, sample data.
Yeah. So okay, great. So so there are some questions. Actually, one is related to that. So somebody wrote in and said specifically that they've been trying to do some similar things for their company, but their HR organization is extremely reluctant to share data similar to what you showed as sample data. And the question is, do you have any suggestions, or how did you work to get, I know what you showed is not the real data, but how did you work to actually make that real data available? Any suggestions for this person trying to create a similar visualization?
I think that because this is sensitive information, that's why HR may not be reluctant to share that. I know when I supported HR and worked directly within HR, it was very hard for individuals who were outside of HR to get access to that information in terms of, especially when we're looking at like employees who are at risk. That's something that you may not want to share, even if it is aggregated, because with some of these visualizations, if you don't have security in place, then you can easily download, that workbook and dive into the underlying data set, and you just want to eliminate that as a whole. I would say if you are within HR, maybe talk to HR about security implementations around like if you are within like a high level of the organization, being able to dive into, the state level information. But if you're not, if you don't have like, high clearance within your organization, maybe only providing information about the states that you support. So things like that, or the regions that you sit in, so that you're not accessing information for employees who are outside of, your smaller department in your organization. So I would see if HR can maybe drill that down to maybe providing you with a data set or visualization that's around the area that you support individually.
Thanks. So another question that came in, I think this is the one that Glenn was referencing. So someone asked, what other risk factors do you wish you would have been able to include, but maybe just weren't able to get because the data wasn't available? But is there anything else that you think would have made this particularly implementable or important, but just didn't have the ability to get the data?
Definitely. I think information about your household is important, because it's not just, you who might be going out, or, you who is working. Understanding your household and who's coming in, who's coming out would be some information that I would like to have access to. The type of role that you are in, and if you are like an essential worker within that role. So I know when I was at Comcast, we had professional roles, and then we had service roles. So you have your technicians who are out in the field, running wires or setting up boxes, things like that. I would want to identify those employees as well, because those may be employees who are still at risk because they're actively out in the field. So I would definitely say household information, and I would say the type of work that they're doing within the organization are fields that I would want to bring in.
Okay, thanks. And so just a quick follow-up on that. So do you think there's any avenues that can be explored to get that type of information, or is that just really just not likely to be available for anyone?
I think in terms of your household information, organizations can send out surveys to their employees as long as they specifically say an employee has the option to opt out. Your employees aren't required to provide certain information, and this is one of them. So I think that as long as an organization is collecting or sending out a survey that is applicable to the things that they're trying to measure, then that is data that can be collected. So my survey only had pre-existing medical conditions, but you could easily include other factors into your survey and then build that into the Tableau workbook as well, to say if they have this, or if they have that, or if they have this, then they may be considered an employee who's at risk.
Great, thanks. So another question from the audience is a little more general. So the question is, what are the best practices for screening for implicit bias in predictive data analytics? And this person mentions that they were specifically impressed by your consideration of age bias when looking at the data from HR.
Yeah, definitely. I think so. The original visualization, I will say this, that was posted had contained an error in it, and I love the Tableau community because they pointed out the age bias that was depicted when that wasn't the case that we were going for with this original visualization. So we had a lengthy conversation in the community around age bias and making sure that we aren't saying that just because an employee is older, they are susceptible to getting this virus. Now, in terms of predicting anything with this data, I strongly recommend against it. And this goes back to Steve's discussion this morning, right? Or excuse me, earlier. Was it this morning? Well, we started this morning. It was more of this afternoon. But Steve, being the first presenter, he really touched on, if you're not an expert within this field, even if you're just a data scientist, you do not want to go around like forecasting and predicting these numbers and these cases, and then which of your employees may be at risk, because you just aren't an expert in this field. If you are a data scientist looking to factor in some of those predictive models, then I would definitely encourage you to reach out to someone in this field to understand the best way to do that, to make sure you aren't bringing in like that implicit bias into it.
Great, thanks. So this will be the last question that I'll ask from the audience, and I'll turn it back over to Glenn. This question actually is very similar to one we asked of Chloe, but I think it's good to get your perspective on this as well. And the question is, for somebody just starting out, how do you recommend that what tools, what training, what things are available for them to start exploring this and producing data visualizations and case studies like you showed today?
So I would say someone who is getting started in this field, it can be, I consider it two types of people, right? A person who has a data background in general, a data literacy background in general, and a person who has a data background but is now trying to produce visualizations to portray like, their findings. So I'll say if you are a person who is just starting out in the data field in general, and you do not have a very good understanding of, how to understand, read, and write data, then I would direct you the route of first understanding what data means, various data terms, as Steve mentioned, when to use median versus average, things like that, because that's going to play a very big role in the visualizations that you create. However, if you are a person who is already familiar with data and how to use data, I would say in terms of the visualization route of it, always tell individuals, like, start with a question, right? What is the question that you are trying to answer of your data, and then create a visualization that's going to best answer that question, right? So make sure that individuals who are looking at your visualization can also answer that question using your visualization. I always start simple. Most of my visualizations are line charts and bar charts because I think they are the things that you can best understand. So that's kind of like the route that I would take. There's a lot of data art out there. Don't be discouraged if you can't produce that at first. Definitely go the route of simple is better, and just trying to make sure that your visualizations portray some type of observation or insight.
Great, thank you. I think that's fantastic advice.